as you noted from my bio, I'm a certified nurse midwife, and I've been in that field for the last 2 years. So when I was asked to speak today, it took me kind of a minute to figure out what in the world I was going to say. Because my first thought was just like, what don't I do with women and gender studies? And then like, go sit down. But I figured that wasn't exactly what you wanted to hear. So I decided to kind of start at the beginning. I was in my late 20s, I was a stay-at-home mom, and I was really trying to figure out, so who am I now? I haven't worked for a while, who am I? And I attended a friend's birth, and her midwife said to me, you should be a doula. You'd be good at that. And I thought, I don't know what that is. So I looked it up, and it was a non-medical birth support person, and it really sounded great. And I got really interested in birth work. But it turned out that rural Marshall County wasn't the best place to start a doula practice, so not a lot of interest there. And so I thought, okay, well, I guess I'll go be a nurse. And so I dusted off my GED from 10 years previous and enrolled at IUSB with the goal of going to the nursing program. And I just had to get those prerequisites done. And the only prerequisite, the only elective that I could fit into my schedule was a 400 level Women and Gender Studies class, and that was my first semester at IUSB. So I took it, and I freaking loved it. Like, it was amazing. And I thought, I'm gonna take as many of these classes as I can while I'm waiting for the nursing program to be available, and I did. Finally, just prior to getting into the nursing program, I took the 100 level intro to gender studies so I could get enough for my minor in women and gender studies. So
wonderful advising.
Yes, yes. So when I entered the actual nursing program, I was intrigued because so many of the themes were the same. We talked about cultural diversity, marginalized people. How do we get at disparities? What are we doing about them? As members of humanity, how are we working to make things equal and have social justice? And that was part of nursing as well. And so what really helped me throughout my sort of healthcare path was the lens of women and gender studies, because it focused me. It's so easy when you're developing a passion to just go, I want to do it all. I want to do everything. But for me, I knew women's healthcare was where I wanted to be. I knew birth work was what I wanted to be doing. And I knew that equality, I wanted to work on equality. I wanted to, fix racial disparity. I wanted to improve access to healthcare for people in our community who maybe don't have it or are marginalized. And so when I graduated, I was able to work as a nurse in postpartum and do lots of education, and sort of big component of that is social work, which a lot of people don't tell you about nursing. A lot of it is, they're always like, oh, postpartum, that's so happy. It's the happiest place. And you're like, yeah, kinda. There's a lot of stuff going on I don't want to tell you about, but it is cute babies though. But as I rolled along, it struck me that the healthcare system in general is not set up for members of our community who are marginalized, because they're not the majority and they're not the money makers, and healthcare is an industry and it works on our money, and we're consumers. A small number of consumers, they're not that important. So I thought, well, I have to do something more. I can't just stay a nurse. I don't really have that much power. I'm gonna go back to school. And so I did. And that was a challenging degree. I really enjoyed all the things I was learning. And as I was leaving Frontier Nursing University, I really looked around for a place where I could take my women and gender studies experiences, my nursing previous experiences, and also combine that with my commitment to our local community and increasing access to care for folks who maybe don't have it or can't find it. And so federally qualified healthcare center was where I wanted to be. And if you don't know what that is, we receive funding from the government. We don't turn anyone away. We will take literally any insurance. So all of your insurance is good at HealthLink. But we will take any insurance. We will take no insurance. You do not even have to have proper documentation of who you are or where you're from. If you have healthcare needs, we will see you. And that called to me. And it also calls to others in our community. So it's been really nice to work for a facility that cares so much about people who may not otherwise have someone caring for them. In fact, I was really thrilled to learn that part of our ongoing education is how to combat racial disparity, how to properly treat trans youth, how to be sensitive and expert when we're caring for folks who don't identify with the majority of people. And that's been really important to me. That's been really hounded into us at HealthLink. And so it matches so well with sort of what I thought my vision should be. The lens of women and gender studies matches so well. And so it's a privilege to work with people who think like that. It's a privilege to care for people who maybe have never received care before. It is a privilege to be able to continue to do research on how do we get at things that, bother us. Like, as a midwife, one of the most astounding factors for me is that women of color are 3 to 4 times more likely to experience morbidity or mortality with childbirth and the surrounding than white women. And we don't know why, because even when we solve for factors like education, socioeconomic, things like that, they still suffer more, 3 to 4 times more. So we're collecting research on that, trying to kind of get at some of those disparities and pick away at things that level the playing field. And so I really do appreciate the opportunities that I gathered at IUSB, the opportunities to speak in front of a crowd during Michiana monologues with wonderful Dr. Ladinsky. I did that for several years. It was an amazing, amazing experience. I loved it. I sometimes miss IUSB days because work is work, but a lot of the things we did were fun and it was learning, and I really felt so passionate about it. Women and gender studies really helped me, as I said, form a lens through which I've been able to navigate where I want to go with healthcare, what I want to do with healthcare, what's my vision of healthcare, and it continues to allow me to focus so I can stay committed to the cores that I see, which are access to healthcare, reproductive rights. I want people to have equality in healthcare, and if I can do that at the place I'm employed at because of my undergraduate nursing degree and because of my minor in women and gender studies, I'm all the happier for it. So, thank you. And I guess really, what can't I do with the women and gender studies?